My name is Darren Kies. I am the Section Chief of Interventional Radiology for Piedmont South Imaging. So the types of sedation that we use in interventional radiology for local regional therapies can vary greatly depending on the invasiveness of the procedure. Most of these procedures are outpatient procedures where the patient comes in, has the procedure performed, and goes home the same day. Very, very rarely for any type of interventional radiology procedure or local regional procedure will a patient be asked to spend the night unless something unforeseen or an unexpected complication happens. With regards to sedation, there are several procedures that are performed with just local numbing medicine, but the majority of the local regional therapies that we use for oncology, Y90, chemoembolization, percutaneous ablation, we are going to be using some form of moderate sedation or deep sedation with an anesthesia team. When it comes to catheter-directed therapies such as Y90 or chemoembolization, we tend to just go with moderate sedation that's overseen by the interventional radiologist and our nursing staff. We use intravenous medications, mainly Versed and fentanyl, which provides a level of sedation so that patients are sleepy. They're not very concerned about what's going on, but they are arousable. If you kind of rub their chest and talk to them, they can follow commands. One of those commands that we often have to give folks is that they need to hold their breath while we obtain our images, and that can be very helpful. So we don't want patients completely out, and sometimes patients are a little surprised to hear this. They want to be put completely out, but an angiographic procedure such as a Y90 or chemoembolization is very non-invasive. A lot of people have moved towards radial access for these procedures, so it's a tiny little puncture in your wrist. It's not a painful procedure other than having some lidocaine administered, at the access site. Once the catheters are in, it's generally not something that patients can feel. So, really, really deep sedation just isn't necessary. Now, some of the local regional therapies we do that aren't related to, catheter angiography are, to a degree, slightly more invasive. We're still talking about punctures with needles and devices like that. We're not doing open surgery. And many patients are okay with just moderate sedation. But specifically to procedures that are percutaneous, where we're putting needles or devices into the liver, that is something that can be a little bit more painful and requires a little bit deeper degree of sedation. Interventional radiologists 10 years ago very rarely interfaced with our anesthesia colleagues. But now there's a whole minimally invasive movement in anesthesia where there are certain anesthesiologists that are very specific to these minimally invasive procedures. And we've partnered with them, and as many groups have, to help provide deeper degree of sedation when we need it. And generally, this is just called monitored anesthesia care. It's not something that requires endotracheal intubation. You don't have to have the breathing tube in your throat. You just get a little bit of deeper sedation with intravenous propofol and other medications that the anesthetist can administer. And this allows us to do things percutaneously through the skin, and the patients won't remember this. They're still breathing on their own, again, usually not intubated, but a much deeper degree of sedation such that they have no recall of the procedure that went on. Finally, some of the procedures we do, and sometimes with patient's preference, or if there's a patient-specific region, there are scenarios where we will intubate patients and have them completely asleep and paralyzed. Sometimes for liver ablations, every time you take a breath, your diaphragm moves up and down, and so you're trying to treat a moving target. And it's actually quite beneficial to have someone paralyzed so you can hold their respirations while you position your needle. Even so, in those cases, patients generally can go home after anesthesia, even general endotracheal intubation, they can go home the same day. So again, we have varying degrees of sedation that we use for our patients. The majority of patients receive moderate sedation. There are some patients that require deeper levels of sedation, but the vast majority of patients are done on an outpatient basis and go home the same day.